Thank you so much for joining us here on News 12 for this special report on the coronavirus outbreak. I'm Amanda Bossard.
And I'm Jessica Cunnington. Tonight, we are breaking down once again this outbreak and what it means for the people here in our city. We have an expert here in studio tonight ready to answer any questions and concerns you may have about the virus and how it may impact you. The number to call tonight is 718-861-6827.
And joining us here tonight is Dr. Rossi A. Hassad, an epidemiologist, a statistician, and professor at the School of Social and Behavioral Sciences at Mercy College. Doctor, thank you so much for joining us on what has been a whirlwind of a news day when it comes to the coronavirus outbreak.
It has, and I think today will prove defining in our response to this epidemic. In particular, the tone and the message from the press conferences held by the governor and the mayor. The message was sort of grim, but I think it's important because it placed the emphasis where it should be, and that is on social distancing. And I think we should all be happy because we know it works. We have seen this across the world, especially in China, Singapore, and South Korea. So we know what works. We have seen this before. And so I'm encouraged by the messages from the press conferences.
Moving in the right direction.
We are clearly moving in the right direction.
And let's get through all that we've learned today because it has been a lot. Governor Andrew Cuomo saying there are now at least 328 confirmed cases in New York State, at least 95 of those here in New York City. And that's up 42 from just yesterday, so more than doubled.
And Mayor Bill de Blasio declaring a state of emergency here in New York City, meaning that he can now take drastic measures that are necessary to stop the spread and treat the coronavirus.
The mayor guessing that this pandemic could go on for months and that the recovery process will also take quite a while. The mayor saying the spread of the virus is having a big impact on people's livelihoods. He says support and relief, though, will be made available to those who are affected while companies shut down and quarantines go forth. Both the mayor and Governor Cuomo tackling this public health emergency by taking action to try to stop the spread of this virus.
So groups of more than 500 people no longer allowed in New York State. Think parades, sporting events, concerts, business conferences, things of the like. And tomorrow at 5 o'clock, bars and restaurants here in New York City will only be allowed 50% of their normal capacity. These density rules don't apply to hospitals, schools, or mass transit, though.
Another measure that Governor Cuomo is taking on is testing. He is focusing a lot on testing. This isn't as much to know how many people are infected, but to be able to know the ratio of those being hospitalized so that the government can make sure they can provide the care needed.
And former nurses and doctors are also being encouraged to reach back out to their old workplaces and offer to work as they're needed. The state is also looking to identify those who have been trained as doctors and nurses in the military, and even looking at medical schools in the area. Both Cuomo and de Blasio reiterating that the state of the city and the state is changing day by day. We saw that today.
Just today, and Mayor Bill de Blasio did say most people will be able to self-resolve and won't need any medical attention here. They should be able to do 5,000 tests a day if necessary once the FDA approves a facility in the city that can test.
And the idea is that the more people that you can test, the more you can then quarantine and then stop the spread.
So while there's no word from the Diocese of Brooklyn, we are hearing from the Archdiocese of New York, and a big decision because it announced today that Catholic elementary schools throughout the state will be closed for a full week in wake of the coronavirus outbreak.
As of right now, they will be closed starting Monday through Friday, March 20th, but the Archdiocese says it is possible that could be extended. The Archdiocese says the move is being done out of an abundance of caution. At St. Raymond Elementary School in the Bronx, students were already told that they'd be closed Monday and Tuesday, but with this news, they'll now be out of school all of next week, again, just as a precaution.
I kind of get it because it's the coronavirus, so it's like really dangerous for the school. So I think it's good that they're shutting it down.
It'll be fine. It's just another thing that will pass on too.
Yeah,
these things happen. Just everybody protect yourself. Wear your gloves. Wipe your kids down. Give your kids hand sanitizer. Drink lots of vitamin C.
The Archdiocese of New York also saying all Catholic youth organizations, sports, practices, and events have been canceled indefinitely.
And lawmakers down in Washington, D.C. are working to protect families across the United States.
The House of Representatives voting today on a legislative package in response to coronavirus-related economic fallout. That package, released by House Democrats yesterday, is also known as Families First legislation because it includes paid sick leave, expanded unemployment insurance, free testing, and funding increases to food security programs to provide support to families affected by the pandemic. Democratic Senators Kirsten Gillibrand and Cory Booker urging fellow senators to pass this measure.
To not have paid family leave means that this problem will compound, it will spread further, and it will last longer.
Imagine how different this crisis would be right now if every worker knew that they could meet the needs of the loved one or themselves if they're sick.
However, Republican senators do not expect the package to pass the Senate. Even if a compromise is reached, it's not clear how quickly it could pass through both of those chambers.
All right, Disneyland out in California announcing today that they will be closing their parks. Disneyland Park and Disney California Adventure will be closed starting March 14th through the end of the month. Disney says hotels of Disneyland Resort will remain open until Monday, March 16th to give guests some time to make necessary travel arrangements. At this time, the closure does not affect Walt Disney World down in Florida.
And back a little bit closer to home now, the Great White Way has gone dark. Broadway suspending all performances until the week of April 13th to stop the spread of coronavirus. The Broadway League says it made the decision under the direction of Governor Andrew Cuomo. The league says that ticket holders should contact their ticket outlet for refunds and exchanges.
And the Metropolitan Museum of Art is closing all 3 locations, including Fifth Avenue, the Met Brewer, and the Met Cloisters, all starting tomorrow. During this closure, the museum will be cleaned. Officials are set to announce additional steps next week. Look out for that. The president and CEO of the museum saying the goal here is to ensure a healthy and safe environment for everyone. And we just learned the Brooklyn Museum will be closed temporarily starting tomorrow as well.
So a lot of news about this outbreak, a lot of new news today. We want to get right to some of our callers because a lot of questions in light of this news. I believe we have Jacqueline on the line. Jacqueline, can you hear us?
Yes, I can hear you.
Great. What's your question?
I have a 2-year-old daughter, right? And I noticed that some of the symptoms are, the coughing, the runny nose, and things like that. My daughter, she has a very low immune system. So how can I do to help her from, getting it or even knowing if she do have it?
Yeah, doctor, what are your thoughts?
Your daughter is in a category of people that would be deemed to be at higher risk, and that is a compromised immune system. And so it's absolutely essential that you observe the protective measures, both for yourself, your daughter, and those close to her. And those measures would be personal hygiene, washing your hands regularly and as needed, your daughter's hands, making sure you wash with soap and water or hand sanitizers. If you're not somewhere where you can use soap and water, covering your cough and sneeze, and wiping down surfaces that are contaminated at home or wherever your daughter is.
Thing to keep in mind. That'll keep the whole family
Correct.
safe and healthy too, but another thing definitely to keep at top of mind for
those are basic
kids.
measures,
right?
And we have control over doing them. Washing our hands, respiratory hygiene, and wiping surfaces that are contaminated.
Simple things to keep in mind, but to do proactively,
and we know
especially at
they
this time.
are effective.
Right, that's the thing. We're not just saying it, it's proven, and you're hearing it from the doctor.
They sound simple sometimes and unscientific, but they are effective.
Good to keep hammering home too. Well, obviously with all of these updates, especially in the past 24 hours, a lot of news to share, a lot of the stories being shared on social media because, I mean, it's constant, it seems, the past few hours and the past 24 hours. So we keep getting a lot of comments and a lot of questions via social media. So we do want to get to one from Doran M, who says, "Hi, I'm pregnant and due in 2 weeks. Nothing has been said about the virus and pregnancy. What do I need to know?"
Well, Doreen, your question is quite timely because the Centers for Disease Control and Prevention held a special session today for clinicians on how to address the needs of pregnant person. And what they identified was that pregnancy does bring about certain physiological changes which can lower your immune response. And therefore, great care should be taken during pregnancy. And because we do know, apart from this infection, you are at a greater risk of infection during pregnancy. It's called cell-mediated immune response. That's the immune response other than the antibodies that are usually involved in your immune response. So yes, there is some level of risk that is brought on by pregnancy.
Good to know, especially given that those guidelines and that session was held just today.
Correct.
Wow.
Yes.
We have a lot of questions coming on social media. We're going to get to another social media comment that came in, I believe, on our Facebook page. This one from Diane. She asked, should people with compromised immune systems avoid airline travel?
Okay.
The quick, short answer is no. Airplanes, the risk of infection from airplanes is considered low, and this is also from the Centers for Disease Control and Prevention, because of the way the air circulates and is filtered on board airplanes. It is considered to be low risk of infection for viruses and most pathogens or germs.
A good point to make, because I think a lot of people assume the opposite, so it's good to have that clarity, especially for those who do have compromised immune systems and trips planned in the foreseeable future.
So again, just be aware of your body and what it can take, and then also what you're doing to prevent this virus.
And again, you practice those basic protective measures even if you're on the plane. Hand washing, respiratory hygiene, and wiping the tables and surfaces.
Yes. Welcome back to this coronavirus outbreak special here on News 12, and hello to those who are watching on Facebook as well. We are getting right to some callers who are waiting on the line for Dr. Hassad right here. So we want to get to Marilyn, who's been waiting. She's up in Wakefield. Marilyn, what's going on at home?
Hi, good evening, guys.
How are you?
I'm doing well, thanks for asking. So I was calling because I have an 18-month-old who is home on a ventilator. He has a neuromuscular disorder, and he does get early intervention at home, PT, OT, speech with feeding, and I do take the precaution as far as hand washing, gloves, and masks, but is there any other precautions that I should be taking when these people are entering our home?
Well, Marlene, anyone on a respirator outside of a hospital or a controlled environment, there is an added risk of infection. And I know the Centers for Disease Control has issued guidelines to clinical practitioners. So I would strongly advise that you check with your practitioner for any additional precautions that you should take at this time.
Yeah, definitely a time to be in good communication with a physician in this case. We do have another caller on the line, Chris, who is in the Pelham Parkway section of the Bronx. Chris, can you hear us?
Yes, I can.
Great. What's your question?
Well, thank you for taking my call, Dr. Rossi. How important is water temperature whenever you're washing your hands with the soap and water for 20 seconds?
A very good question, and it's important to the extent that you don't burn your hands, and also to the extent that you benefit from the soap you're using to get the soot from the soap. So you don't want water that's too cold or too hot. Warm, regular temperature would be fine.
And for those 20 seconds is
and
really
you
what
wash
we've
your
been
hands
hearing,
well
right?
for 20 seconds.
Okay.
Yes.
No one's asked that question yet, Chris, so thank you for that. We're here in wash, but let's get specific. Warm is good.
Yes.
And you're good to go.
Yes.
Thank you, Chris. And let's get to another Facebook question because they just keep coming in. So let's check out what we've been hearing on social media, what we've been getting on our Facebook page from Daniela. Should people take cruises still?
You know, Daniela, this virus is so widespread across the world. There's still a number of countries that have not reported cases. but they are at significant risk. I would strongly advise against taking a cruise at this time. You may leave, but upon your return, have to suffer the inconvenience of being in quarantine. So unless it's absolutely necessary or essential, I would strongly advise against such a trip at this time.
Yeah.
Good information, especially for those who are trying to make plans in the near future. We do have another caller on the line, Laura, who is in the Highbridge section of the Bronx. Laura, good evening. Can you hear us?
Yes, I can. I'm outside. I hear you very well.
That is great. Can you go ahead and ask your question, please?
My question is, no one has mentioned as far as buying vegetables and milk containing certain things. Can the virus stay to it for a length of time? Because I wash all my vegetables and everything, but my question is, can the virus be on, you know, like your grapefruits or your apples, your oranges, your lettuce, if someone that has the virus touches the vegetables or fruit?
Hi, Laura. I'm glad to hear that you wash your vegetables and fruits.
Yes,
that's good. That's a very good practice. The best science available tells us that this virus does not survive well outside of the host, be that a non-animal, a non-human, or a human host. So the general advice is you're relatively safe. Although you would hear reports that the virus can survive from 2 to 11 days, that's highly theoretical. And the virus is relatively fragile and does not survive well outside of the human host. So I would say your risk of infection from your vegetables and fruits is low to zero.
Okay, and continue washing them too.
Of course.
So, yeah. Laura, thank you for that. Let's get to another Facebook question tonight. Let's check out what's coming in now on our Facebook page from Denise. Can coronavirus be sexually transmitted? We were just talking about this earlier.
In the strict sense of sexually transmitted, it is not. So let me say that quite clearly. Coronavirus disease is not sexually transmitted. However, if you are in close contact with someone, you have to understand that droplet spread is facilitated. So if you are in close contact with someone who has the virus, then you're increasing your chances of becoming infected. And that's purely because of close contact. So any act or any behavior would increase that chance.
And that's so important in terms of why we are kind of pushing this social distancing idea more and more as the days go on. We do have another Facebook question, a question that's coming in the comments section there. This one is from Steve. Is it safe to eat at restaurants and fast food chains like McDonald's, etc.? Doctor?
Absolutely.
Okay.
Foods are cooked at high temperatures. Again, the virus does not survive well outside of a human host, and you practice your protective measures, your hand hygiene, respiratory hygiene, and cleaning surfaces, be that the table you're sitting at or somewhere else.
Right.
And we've been receiving a lot of, I know myself personally, emails from different places that I frequent, kind of reminding us of all of the measures they're taking to make sure that everything they've been doing is sanitized, especially more so now. So at least that kind of allows us to rest a little bit easier when we're thinking about going out to those places.
Right, just as we're being reminded to keep our hygiene tippity top and to be washing and washing, so are employers and these business owners.
Exactly.
All right, we're going to be right back here on this News 12 special report. Stay with us.
Welcome back to this News 12 special report on the coronavirus outbreak. We want to take a minute to thank Dr. Hassad for all of the information and the answers that you provided our viewers. I think we all learned so much tonight. If there's one message that you'd want people to take away as we continue to see this coronavirus outbreak evolve, what would that be?
First I must acknowledge that there is a heightened level of anxiety and fear, and justifiably so. But I want to say that if you look at the mass of data available, we have had over 127,000 cases. That's a large sample. It provides us with a fairly good understanding of how it will behave, the virus will behave here, and the trajectory we can expect. Primarily, I know it has been said many times, but it is true from the data. We can expect that close to 80% of the people who become infected will have no symptoms or mild symptoms and will fully recover. They will suffer some inconvenience and a bit of disruption, but it's reassuring to know they will recover. Therefore, we should focus our efforts and resources largely on the 20%, those older people and those with underlying health conditions who are at significantly higher risk.
Thank you again for the reassurance as well. If you do have more questions, you could head right on over to our News 12 Facebook page, where we'll continue to address your concerns and questions on Facebook Live, and again, complete coverage on news12.com.